Okay, you guys, so I'm in the car, so sorry if this video is a little bumpy. I'm back new to this whole YouTube vlogging thing, so I don't know if there's stuff out there that's supposed to stabilize it while you're in the car and make it not so shaky and bumpy. But anyway, today is a very big day because I am out. I am actually on my way to my pre-op appointment for my mommy makeover. So super excited. I feel like this whole situation kind of went from 0 to 100 because I literally just paid my deposit like a week ago, and I just decided like maybe 2 weeks ago that I was going with the doctor that I'm going to, but because I was a month out from the desired date that I wanted to schedule my surgery, it's all like moving very quickly. So literally paid my deposit 1 week, scheduled my pre-op for the very next week. I'm about to stop at Starbucks before my appointment. And yeah, and my surgery is, I'm like a little under a month out now. So it all feels like it's happening very quickly. I feel like this appointment is going to make everything feel like very real. I don't really know what to expect. All I know is they told me to prepare to be at this appointment for a couple hours because they said it is like information overload. And I guess I'm going to just get an overview of what the next couple of weeks will look like leading up to the procedure, because I know there's certain protocols leading up to the procedure and like restrictions and different things like that, and probably giving me the walkthrough with like having to put in the prescription and order all my medications and stuff that I'm gonna need after. And then I'm assuming give me like a big overview, detailed overview of protocol for recovery and post procedure as well. So I'm hoping that I'm gonna leave this appointment today really kind of feeling like, okay, I have a really big detailed picture of what all this is about to look like and entail over the next couple weeks. So forgive me for all the lighting changes because of the sun. I'm in the drive-thru at Starbucks, but yeah, like I said, I feel like this is gonna make everything feel very real. I also have to pay my surgery in full today, which is another thing with it moving from 0 to 100. I really didn't have a lot of time to save because all of this kind of picked up very quickly, and I ended up booking and scheduling a lot sooner than I thought I initially was. And with my doctor, you have to have the surgery paid off in full 3 weeks prior to your procedure. Considering the fact that I just paid my deposit last week, it didn't feel like I really had a lot of time to like obviously save or prepare, which we have savings and stuff like that, but just for this in particular. So yeah, and that alone is also making it feel very real because no turning back once I swipe this card at this appointment today. So excited, nervous, anxious, all the things. I just pray like once I leave this appointment, I kind of just, nerves are calm and I'm like, okay, I got this, I could do this. I have peace about it all, and more excitement takes over. I found myself kind of getting more and more excited. I'm putting my window up so y'all don't hear that background noise, but I found myself getting more and more excited when I see things that I want to buy, or like out shopping. I actually just bought, and funny enough, it's like not even anything really exciting or fancy. It was it was all from Lululemon. I saw this other influencer like link it, and I just thought it was so cute, but it's something that I would never buy like now pre-surgery. And it was like a little crop top, like kind of sports tank, and then the matching like leggings, and she had this matching like puffer vest, like cropped puffer vest over it, and I just thought it was so cute for like running errands or whatever. But I would never buy that now just because I'm so insecure about my midsection, and that purchase made me really excited for the procedure, because I'm like, people don't realize it's like the smallest things when it comes to just feeling good about yourself and your body, and something small as being able to buy like a leisure outfit, not even anything fancy, but stuff that I would just never be able to or feel comfortable with picking off the rack. Now I can shop for, and I have something to look forward to post procedure. So things like that are kind of making me excited, more excited than nerves, because I would say I probably have had more nerves than anything up until this point. But like I said, hopefully after leaving this appointment, I just feel at peace with it and I kind of have an overview of everything. So I will try and take y'all along for the appointment. I didn't bring my tripod to like film while I'm in there, but maybe I can prop my phone up or something. But I'll try and show y'all my doctor's office. It's so cute and nice. And then once I'm done with the appointment, the second half of this video will kind of be a summary over what they told me and what I can prepare for and expect over the next couple weeks, so that way you guys have that information and knowledge if any of you are thinking about taking a leap and getting a mommy makeover and getting this procedure done. So I'll keep y'all posted. Okay, y'all, it's time for the pre-op little recap. This is actually a couple days past my pre-op. I was so excited after I left and I was ready to like give you guys a summary of it, but once I got home, the day got away from me and just days went by. So now I'm just now getting to it, which is crazy because I am now officially under a week out from my procedure, which just saying that out loud, it like gets me excited, but also gets me nervous and anxious as well. I'm definitely feeling all the things. So today is a Thursday. I don't know when it's going to be when I put this video together and share it, but just to give you some context, like today is a Thursday and my procedure is next Wednesday. So literally just a little under a week out. I'm feeling all the things right now. And after like watching so many videos, TikToks, YouTubes, reading reviews, it seems very normal that the few like days or weeks leading up to it is very normal to feel nervous, anxious, excited, getting cold feet, like all the things. But trying to focus more on the things that I'm excited about than the things that I'm nervous and anxious about. So that's where we're at now. I have this little bag that I got at my pre-op appointment with all the info. So I want to just kind of tell y'all how that went. I remember saying on the way there in the car when I was chatting with y'all, like, I hope I leave this appointment like more excited than anything. And I can say that I did. Just kind of having the overview and like, this is real. Like I took my before pictures, like all the things, and I'm like, okay, this is really happening. But I remember when the doctor came in, because I talked to a few people before I actually talked to the doctor. Now this is kind of why I wish I would have did that same thing, because now I'm trying to remember. But I checked in. So I talked to the nurse. I talked to her first. So she came in and it was like information overload. I was there for like an hour and a half, so not too long. And it went by fast because it was like so much information. But we went through a 32-page packet of information that I basically had to sign my life away. She had a digital version on like an iPad that she kind of walked me through, but then they give you the whole thing in like paper form for you to take home, because there was multiple consents that I had to like sign throughout it on the iPad. But they give you the packet where she highlighted a lot of like the main stuff that I needed to know so I can remember and take home with me. But yeah, I had to go through a 32-page packet, page by page, with the nurse. I will kind of go through this, like some of the important stuff that we went over with you guys, just so you can kind of have an idea of what a pre-op appointment looks like, or like the important stuff for the day of, the days leading up to it, and the days after. It's kind of like everything we went through. Then I went through all my medications with her. So they give you like a really detailed like sheet of, and I was like taking notes and everything because it was like so much information. But it was a detailed sheet of all my prescription medications and my over-the-counter medications. They gave me a few like over-the-counter things that I'll share with you guys, but then like 6 of them were prescription meds that they had to send to the pharmacy and that I just picked up like a day or 2 ago. I actually probably should have brought those in so I could share my meds with you guys, but they have them all here on the sheet too. And then we went over like the drain care, because I will have drains. I feel like I haven't talked to y'all much about the whole like drain situation, because going into this, I initially really wanted to do the drainless tummy tuck, and that could be a whole video of its own. So some doctors use drains for their tummy tucks and some doctors don't use drains. I feel like 80% of doctors use drains and like 20% don't, because it's like a special technique that you have to do to not use drains. And my doctor says she can do it too, but once she kind of tells people the pros and cons of having drains versus not having drains, that most people lead to having the drains because it just helps with swelling. You see your after results quicker because you don't have a lot of like fluid or like buildup or anything like that. So anyway, I will have drains for my procedure from anywhere from a week to 3 weeks post-op. I don't know how many I'm gonna have. You can have from like 1 to 2. But yeah, so we had to go through, it's like a whole packet on like drain care, how to empty the drains, all of that good stuff. There's a chart here that I will have to bring to all of my post-op appointments, because I'll be having to document my output of the fluid for the drains. So we went through that in the appointment. So it was definitely information overload. Actually, since it had been a few days, so I want to say this appointment was a little under 2 weeks ago. Last night I actually got out a notepad so I can go through and write out some of the important things that I needed to know before the operation that I had forgot from this appointment. I had to like go over that last night, like all over again. Like, let me get a 1-sheet summary of just like the big stuff that I need to remember. So I did that last night because there's a few things that I have to do leading up to the appointment. Like one of the over-the-counter medications, which is Arnica, and it's tablets. And I started taking that 2 days before the surgery. I was trying to see how long I take it after. I guess it's just taken as needed after the surgery, but it's an anti-inflammatory supplement and it's supposed to help with like bruising and swelling. So you start taking it prior to the operation. So I needed to remember the exact days because now I see it's 2 days. So that'll be, I guess, next Monday, since my procedure is Wednesday, that I start taking this. And then there was another recommendation that they tell you for Gatorade. She told me what the benefits are, but I forgot. So I'll have to ask again and I'll tell y'all that in another video. But there's something about Gatorade that they've done research to where if you chug it like right before your procedure, it has some type of benefits. Maybe it's the electrolytes. I don't know. I don't want to lie. But I have to take it the night before my surgery and you have to chug it. It's like 12. They want you to do 12 ounces twice. One is the night before, and then one is 3 hours before your procedure. So I have to check in at 7:30 next Wednesday. So at 4:30 in the morning, I have to wake up, chug 12 ounces of Gatorade, and then I have to do it the night before my procedure, before midnight. So probably about 10 or 11, chug another 12 ounces. And it was very specific. It was like, it has to be the white, like glacier white cherry flavor. And I remember laughing, and when the nurse was telling me, I was like, that's very specific. She's like, yeah, because we've like tested a few other ones, or it's kind of been trial and error. And she was saying like with people that did the colored ones, like red or blue, it was something with like the acid reflux and anesthesia. So they were like, we see now it has to be like the white one. So anyway, I had to do that the night before. So there was a few things that I wanted to like familiarize myself with, considering the fact that next week it is go time. So like I said, this package just kind of told me everything I needed leading up to it, the day of, and then the few days after, all the way up until my first post-op visit, which I think will be like 5 days after my procedure. But let's see, I'm gonna try and go through this really quickly. It's a lot of information and just pull out the important things. They told me what time I needed to be there, which is 7:30 in the morning. All the information for the facility. This is talking about the Gatorade. Oh, it's the white Gatorade Frost Glacier Cherry flavor. You have to drink it 5 to 10 minutes. So they said you can't sip it, you have to chug it. I was trying to read. Oh, so it tells me right here. It actually tells me in this packet what Gatorade proves. It says studies show pre-op carbohydrate drinks improve pre-op hunger, thirst, and anxiety, nausea and vomiting after surgery, pain after surgery, insulin resistance after surgery, and length of stay in hospital. So I guess that's the benefits of chugging the Gatorade twice prior to procedure, because there's a few videos I've watched where I saw other people taking the Gatorade and I didn't know why they were doing it, but I saw comments being like, oh, I thought you can't like drink or eat like 24 hours before surgery. So people were confused about the whole Gatorade thing. And now I know. I didn't know that when watching those videos, but I do remember like reading those comments, but I never saw anybody explain why they had to do that. So one thing that was helpful, they tell you things that you cannot do like 2 weeks leading up to surgery, 1 week leading up to surgery. 2 weeks, it was avoid pretty much all medications besides Tylenol, any aspirins, Advils, Aleve, Motrins, all of that. You can't take any of that 2 weeks out from surgery. The only thing you can take is Tylenol. Tylenol is safe leading up to the procedure. Another big one that I underlined was you have to discontinue all herbal medications or any like even teas. And I was like, wow, because I drink ginger tea every single day, almost ginger lemon tea. Sometimes I have 2 cups a day. So when she pointed that out, I was like, that's really good to know. Let me underline it. So you can't have any like ginger tea, garlic, herbal supplements, anything like that, because it affects like blood clots, it says blood pressure, and it interferes with the anesthesia. Trying to think what else. You can't have vitamin E, omega-3s, fish oil. They asked me what current like supplements I was taking, and I'm still taking a prenatal because I'm only 12 months post-op. I just stopped, not post-op, 12 months postpartum. I just stopped breastfeeding just a couple months back. So I was still taking my prenatal until my hormones balance out. And a prenatal is almost just like amplified, like just daily multivitamin. So I feel like it's good to take even if you're not pregnant. So I'm still taking my prenatal. I'm taking a vitamin D every day, and then I take a prebiotic and probiotic. And they said all of those were fine to continue up until the day before surgery, because you can't even have water. You can have the Gatorade, but you can't have water. So I won't be able to swallow the water with the pills 24 hours out, but I can take those leading up to the procedure. They said those were all actually like good to continue taking leading up to that. And then when you hit 1 week out, you can no longer have any alcohol, obviously smoking, all that good stuff. I don't do any of that. They do want you to flag if you're sick, because if you're super congested, if you have the flu, if you have a cold, that can interfere with anesthesia. So 1 week out, they want you to flag the office if there's any signs of any type of like cold symptoms, upper respiratory issues, because when you go on anesthesia, that's like really good to know. And I actually am kind of congested. I talked to them earlier this week. They said that's more if you're like really sick, and I'm not like really sick. I just have a runny nose, a slight cough, and I'm congested. But they said from what I told them, I should be okay. It's not anything concerning to where they would want to reschedule the procedure. Just a few other things. No water 8 hours prior to the surgery. I underlined you want to have very like comfortable, loose fitting clothes the day of the procedure for your ride home. They don't want anything you have to like lift up and put over your head. So like something that zips or something that buttons up, and just really, really loose, soft pants, because obviously I'll have a fresh incision here. So something really loose and soft for the pants. Protocol for showering. So I ordered it on Amazon, but it's not here yet. But I had to buy one of those antibacterial like soaps to bathe in the night before and the morning of the procedure. I underlined no deodorant, no lotion, no makeup, no perfume, no hair products, none of that the morning of. And I underlined it because I feel like a lot of that second nature. You shower, you go and put on deodorant, you put on lotion. So I have to really like remember not to do that the morning of the procedure. Let me see. There's a lot of pages that were just like consents and basically tells you everything that could go wrong. But mainly I was just trying to look for the info that I needed leading up to the surgery day of, and then day after, or the days after. Let's see. So I did decide to get what is called this like nerve block, like anesthetic, like pain medication add-on. It's not a requirement. It is an additional fee of $500. It's called Exparel, and it's basically like a pain medicine, or like I don't know all the medical terms, so I'm kind of nervous because I don't want anybody to be like, that is not what it's called. But basically, in my summary, it's like a pain medicine, a numbing medicine. It's like an anesthetic that they actually, I think it's a shot that they do while you're opened up during the tummy tuck, I guess, like right when they're about to finish and stitch you up. And basically it numbs you for like 3 days, for up to 72 hours. And I've heard mixed reviews on this. Some people are like, it was a game changer because you really don't feel much those first few days. You're still in like a little pain, discomfort. You feel very tight, but it's not excruciating pain because it numbs you for like 72 hours. So some people swore by it. But the flip side that I've heard to it is it kind of masks your pain. And so you think like, oh, I'm good. Like it's not as bad as I thought it was going to be. And then when it wears off and it hits you on day 3 or day 4, you kind of feel like you've been hit by a bus, and it's like, oh my gosh. And you're in so much pain. So I've kind of heard some people like, I didn't want to get it. I'd rather just feel it head on, deal with it, turn that curve instead of like masking it and then it hit me out of nowhere. And then some people were like, I would not have changed a thing. I'm so glad I got it. It was a game changer. So I ultimately decided to do it, to go with it. It was an additional add-on as far as price. So I will have to let y'all know how that went after the fact, because obviously I don't know yet. Let's see. Now I'm at the part of the packet that kind of talks about post-op. I have my procedure's on a Wednesday, and I have my first post-op appointment the following Tuesday, so like 6 days after. And so it kind of tells you what to do in between that little window. I'm having, I told y'all before, but in case you forgot, I probably should have said this at the beginning of the video, but I'm having a breast lift, and then a tummy tuck with muscle repair, and then also lipo as well, like just on the sides of the abdomen or midsection or whatever. So it kind of tells me for each thing what I need to do. For the breast lift, I'll be in a bra that they'll provide me with. I will wake up with the bra already on. I have to wear it for, I believe, 3 or 4 weeks straight. I have to wear that specific bra, and then I can start changing it out. I cannot shower for 3 to 5 days. That's for the boobs and the tummy tuck. I can't shower until I get cleared after my first post-op appointment, and then she'll let me know, okay, you're good to take a shower. But it says for the boobs, start off by having the water on your back and not the front, because the pressure may be painful. I can't sleep on my stomach, can't do any physical activity running, jumping, working out, all of that for 4 weeks. Let's see. Trying to see what else. And then I went on to the tummy tuck, and it was pretty much the same procedures. Can't sleep on my stomach. Have to keep my garment on for 4 weeks, 24 hours, even while sleeping. It's basically, the garment is basically like a medical grade, like, what is it called? It's like a medical grade girdle, but it's like really, really tight and can be uncomfortable. And you have to wear it 24 hours a day. Once I'm cleared to shower, I can be out of it for 1 hour just for my showers. But other than that, you have to sleep in it and everything. So they told me about that. And then you have to walk hunched over. You can't straighten up until a couple of weeks out because you don't want to interfere with the incision. It's all going to be very tight because they're cutting skin off, pulling it down, sewing it together. So you have to walk hunched over for a couple weeks. And then as far as sleeping, you can't sleep on your stomach. If I was just getting a tummy tuck, I could have slept on my side. But since I'm getting the boobs too, you can't even sleep on your side because you don't want it to settle in like leaning. So I'll be sleeping on my back. I'll actually be sleeping in a recliner, which I purchased. I think I'm going to do a whole separate video on everything that I purchased that'll hopefully help my recovery go smoother. And it was just based off of a bunch of recommendation videos that I saw and like reviews, because the doctor didn't go into too much about things that could be helpful after surgery. So that was all just based off my own research and stuff that I saw online. So I'll probably do a separate video for that. But as far as the tummy tuck, it was basically just no stomach sleeping and wearing your garment 24 hours a day. Now, once I go to my post-op appointment, maybe she'll give me more information on like scar treatment and all that. But as of now, I don't think I can mess with any of that until I go to that first post-op appointment 5 or 6 days after. It talks about the massages. So you start getting lymphatic massages a couple days post-op, and then like 2 or 3 weeks post-op, you start getting another type of massage. It's the endermology type massages. So once I know more about that, I will do a follow-up video about all of that. But yeah, that is pretty much everything. What is this talking about? Oh, alcohol. I can't have any alcohol for 6 weeks after the procedure. And I can't start exercising until 4 weeks after the procedure, although they say most patients don't feel up to it until 6 weeks post-op. But I guess you're technically cleared 4 weeks post-op. And like I said, I have to wear my garment. You must wear your compression garment during exercise. Up until 6 weeks post-op. But I have to wear my garment for 4 weeks. The only exercise you could do is walk. They do encourage you to start walking, like right after your procedure. So that was everything in this packet. Now I will share about the meds. Okay, so like I said, we went over all my meds that I'll be on. They sent all my prescriptions that day of my pre-op appointment, and I just picked them up. So I have all of them in 6 different prescriptions. So it's going to be quite a bit to keep up with, and like setting timers and making sure I'm staying on top of everything with all the different like windows that you're supposed to take it every 3 hours, every 6 hours, every 2 hours. Like they're all different. So I'll be on a pretty strong pain reliever, narco. Then I'll also be on a muscle relaxer, and those I interchange every 3 hours. I will also be on an antibiotic just to prevent infection. I will also have this patch that it says I'm supposed to apply the morning of the surgery, like behind my ear, and it's for nausea and vomiting because anesthesia can make you nauseous and make you want to throw up. I also have a stool softener, and that's taken as needed because the pain pills and the muscle relaxers can make you constipated. So they have you on a stool softener as well. And so those are my those are my 6 prescriptions. And then I have 3 over the counter that they actually provided me with at the procedure that I already paid for. So I have a cream that you apply like lotion to all the areas that were treated after surgery. And you start this daily, starting the day after surgery. And it just helps the areas heal quicker. This is the one that I start 2 days prior to surgery. It's 3 tablets, 3 times a day, 2 days prior to surgery. That's supposed to help with like bruising and swelling. And then this, was just immune support as well. And I start taking this after surgery until the bottle is gone. So it's an anti-inflammatory supplement as well. So quite a bit to keep up with and to stay on top of. From a lot of the videos that I've watched, a lot of people say they're off of their pain meds like the first 3 to 4 days. So hopefully that's the goal. And then they're just taking like Tylenol at that point. So we went over all of this in the procedure. I have all these meds with me already. And then last but not least, like I said, we went over all of the drain stuff. So I will have a drain coming out of the incision, which kind of freaks me out. I just hate like stuff in me. Like I hate IVs and all of that stuff. So I know this may be a little bit tough as far as the part of the process, but I'm hoping I'm one of the people who can have these out within like a week. But it really just depends on your body, how much fluid you are outputting. But most people have them out within like 1 to 3 weeks. I hope I'm not towards the 3-week mark and it's more of like the 1 week mark. So we'll see. But they went over this in detail about how to empty it. So I want to say it's twice a day. So every morning and every night I'll have to empty the drain. You just unplug it, pour it out, plug it back in. And then I ordered a drain belt, which was once again not a necessity. It was just something that I saw that helps in your post-op period. And it's like a belt you clip on. I got it from Amazon and you're able to put, it has like 2 little pockets for you to just keep your little drains in. I got that. Like I said, I'll do a whole separate video on all of the things that I got to hopefully help me in that post-op period. But that was really it about the drains. Other than them probably being annoying, they're not a big fuss. You just have them on you. You empty it just twice a day. You don't have to clean them or anything. They actually don't want you to like put any type of cleaning products or anything to get in them and compromise that. But that was it. So that was pretty much a summary of the visit. Like I said, I first met with the nurse. We went over all that. The doctor came in. She had to get some like last minute measurements of my boobs, I guess, just to make them symmetrical during the process. So she measured that. She measured for my bra that I will be in for 4 weeks post-op. She asked me, did I have any last minute questions? Kind of just gave me more of an overview of what that day will look like. I check in that morning. She's anticipating about 5.5 hours for the procedure. I assumed Brian would just stay up there with me the whole time, but she said it's more common for people to drop you off and then they just give them a courtesy call. Like once you get out, they give them a call like, hey, she's out, she's doing good, we're gonna monitor her for like an hour. And then they give you another call when they're like, okay, you can come pick her up within like 30 minutes to an hour. Because they were like, it's really not much for people to do sitting up there. She's like, we don't have any snacks, it's like no TV, like nothing. So they told them like, just stay in the area, go shop, go have a bite to eat, like run errands, do whatever you need to do, and then we'll call you. So she went over that, but they anticipated like 5.5 hours for the procedure. I go home the same day. So it's crazy to think you have like this major surgery and then you just go home that day. But after I talked to the doctor, then I did my before picture. So they took me to another room where I was in bright lights on like solid like backdrop with the professional camera. And they took my before pictures of everything. And they said the next time I take after pictures, the first time you take them is at 6 weeks post-op. Then you take them again at 3 months post-op. And then you take them again at 1 year post-op. Because for this procedure, your recovery is really a year long for you to see like your final results. So they say you can see a lot of it like at 3 months out, kind of how you're looking, but you're still like having up and down like swelling for months. So I'm excited about seeing the after compared to the before. Then after that, I checked out. I had to pay, so you have to pay in full at your pre-op visit. Whether you're doing financing or you're just paying yourself, it still has to be like all done and wrapped up at that visit. So my procedure is completely paid in full now at this point, and the next time I see them will be the morning of my procedure. So, like I said in the beginning, I'm feeling excited. I'm feeling anxious. There was a moment in the pre-op where I almost felt like I was getting emotional because the doctor was like, "How are you feeling?" Like right when she walked in, she was like, "Are you excited?" And I was like, "Yeah, but I'm kind of nervous." And she was like, "Obviously that's normal." But she's like, "Girl, you need to be excited. Like this is so exciting." She was like, "It's a big deal." She was like, "People plan for this and save for this for like years." Some people come in here and they're like, "I've been planning for this, I've been saving for this for like 2 years." So it's a really, really big deal. And she was just like, "You should be exciting. Like this is very exciting." And for whatever reason, that kind of made me feel emotional because I'm like, it is exciting. And I'm grateful that I'm able to do this. I know it's going to be a process after, so I'm trying to have a realistic expectation and prepare mentally for the recovery because I already know those first like 7 and 10 days will be pretty rough and I'll need round the clock like care and support. But all in all, it's exciting. And for me, I feel like even more so than just the aesthetics and the outer, it just kind of represents like closing a chapter and like moving on to the next chapter. Like I'm for real done having babies because there's no way I'm paying all this and going through the recovery with the chance of having another baby and messing it all up. So it really just closes a chapter and a season for me. And it's like, man, moving on to the next chapter and the next season, but also excited about hopefully just feeling like myself again, having my confidence back. There's so many videos that I've watched where I did not read one review that was like, I regretted it. Even the people who were given like the real of like what you can expect and the pain level and all of that stuff during the recovery, I've read that there's a lot of up and downs with your emotions during that recovery stage. But every single last review I read, they were like, when it was all said and done, I don't regret it. I would do it again in an instance, and it was all so worth it. So that's what I'm trying to like reflect on these days leading up to it. Like I said, I will do a separate video on the things that I got. I ordered a bunch of stuff on Amazon just last night, and it's all supposed to come in over the next couple days. So this is my bedroom. I'm gonna have like my little station over here on the side of the bed because most people say it's very uncomfortable to try and sleep in your bed like the first few weeks because you can't stretch out. I know the people who do like make their bed work, they have to buy all these like wedge pillows that like elevates them and pillows under their legs because you kind of have to be like this at all times so this isn't like stretched out. So instead, I just bought a lift recliner, which so many people recommended. They're not cheap, so I feel like some people try to avoid having to get it, but I'm hoping maybe I could just resell it after. But I'll have my little station right here next to the bed with my recliner and like all the things. So I will share all of that once it all starts coming in from Amazon in a separate video. But leading up to next week, there's just a lot of prep that's gonna go into it. We're gonna have our nanny staying with us for a full week to start off with. And she was like, I can stay as needed. So if we get to 7 days and you're like, we need you, I'm not ready to let you go, she's flexible, which she's heaven sent. So I'm grateful for that. She's gonna be the person here helping us with the kids so Brian can help me. And then once I kind of get to the point where I don't need 24 hours round the clock help, then him and the nanny will kind of be tag teaming with the kids and their stuff. But the first few days, she's gonna have to like hold it down with all of them. Thankfully, all of them are in school and like daycare during the day, so she'll only have the baby, but she'll have to be doing like carpool and dance drop-offs for those first few days because Brian won't be able to leave me. So anyway, I will be doing a lot of prepping for her, like laying out the kids' clothes for like a full week so she's not having to try and piece together like school outfits, just making sure she has everything she needs, everything's in order, like grocery shopping. She has groceries, she has stuff that she can fix them and cook for them for those first few days. So just a lot of prep to make sure everything is good on the kids side of things, because I got a lot of kids. If you're new here, I keep forgetting, I probably should do an introduction in the beginning of all these videos in case it's a new person like coming across this. I keep expecting it's like people who know me know our family, but if you're new here, we have 6 kids, 5 which live under our roof 24/7, and they're young. It's from a baby, 12 months, a toddler, 2 years old, 5-year-old on up until a 12-year-old. So quite a bit of like, and they're super busy too. They're in dance, have 3 competitive dancers, Beckham's in swim, like all the things. So just making sure everything is together for the kids is what the next few days will be. I also plan on doing just some maintenance for me. I know I'll be home probably at least for like 3 weeks straight, but I'm gonna get like my hair braided because I don't want to have to deal with like my hair and all of this. So I'm gonna get like a style that I don't have to touch. I'm also gonna get my nails done, my feet done, I'm gonna get my lashes done. Like I said, I know I'm gonna be at home, but I feel like I don't want to like let all this get too far like out of control, and then when I am to the point where I can break free and drive and get back out and all that, I'm having to like start from scratch with everything. So that's why I'm gonna go ahead and like have just some of my maintenance appointments. I ordered a meal kit delivery for next week, so I don't have to worry about my meals. So I have all my meals lined up. I won't have to worry about that. Trying to think, is there anything else that I did to prepare? That's pretty much it. So I'll probably do one more video, which is everything that I got. And then after that, my next update will probably be surgery day. And then I'll, take you guys along the recovery journey and all of that. So we are in the final days leading up to it, trying to just keep myself busy. I actually don't have to keep myself busy. I have so much that I have to do that I'm forced to do. So that's kind of helping me keep my mind off of everything. And I feel like next week on Monday, when I have to start taking these first like little tablets, is when it's gonna start feeling real. So all the prayers, but I will keep you guys posted on it all.